All right, so as you know, with plastic surgery, most important thing is the scars. We want to avoid the scars, and so as you know, so there's good scars and there's bad scars. The bad scars are divided into two. Hypertrophic scar is like this one, or keloid scar is here. The difference is with keloid, the boundaries of the scar is overtaken by the scar, so that you get a raised scar, thicker than the initial incision, and the hypertrophic is more like this one. This is a bad scar. We want to prevent it. What way we prevent it is the way the procedure is done, with using specific sutures, with minimal tension, with no infection. And so the main thing is respect the skin, no trauma with suturing, and you want to have as minimal stresses on the scar as possible, so that we can use the tape on top, and we use other modalities to prevent a hypertrophic scar. So here's an example of somebody that did 11 years ago, tummy tuck. You can barely see the scar. It's done here. And then the belly band scar, I do it from the inside, so it heals very, very well. And this is the most challenging thing. So what can we do when you do get a bad scar? There are some modalities we can use, such as scar therapy, or then there's a silicone sheet, and then we can also inject steroids and other medications to help minimize it, especially if it's a keloid. So here's the modalities that can be used. Different one, Biconium is a good one that we use. Mederma is another one. There's other ones, but as long as it's silicone based, that is the best modality.
Scar can spontaneously get smaller within a year.
So here's the modalities differences between a keloid and a hypertrophic scar. As I mentioned, the keloid grows beyond the borders, and usually hypertrophic scars are more intense at after 4 weeks to several months. And then as far as the keloid,
some people use keloids in their body for body art, as you can see here, but sometimes you cannot control it. It might go overboard.